But in studio with us this morning is Dr. Gabriel Njue from Penda. Doctor, welcome.
Thank you so much.
It's wonderful that you took the time out to join us. And thanks to Alfred, I think a mutual friend of both of ours, who put us in touch yesterday. Doctor, it's first of all, I think it's very important, for those of us who are not familiar with Penda, to just explain a little bit about what your organization does and maybe a little bit about yourself.
Okay. Thank you. I'm Dr. Gabriel Njue. I'm about 20 years of healthcare management experience, currently working as the head of medical services in Penda. Penda is a social enterprise that is working with communities in Kenya, which is a low income, low revenue, that is low margin, but high volume business model, whereby we take care of Kenyans, especially in the communities where there is high density and where they have shortage of these healthcare facilities. And so far we have about 17, 18 medical centers across Nairobi. We have in Embakasi, we have in Kayole, we have in Kahawa West, we have in Githurai, all those kind of areas where we see about 24,000 patients every month.
My goodness,
wow.
That's a huge amount.
Yes.
Okay.
Yes.
Right. And before, COVID-19, coronavirus, what is the normal sort of, what are you normally treating these patients for in these areas?
We are basically treating the common ailments that you find in these areas, the upper respiratory tract infections, abdominal infections, the pediatric infections, then the mothers. We have very huge network of antenatal mothers. We take care of the antenatal mothers, quite a huge. So our lot of bulk is the upper respiratory tract infections, the abdominal conditions that come up with, then the well baby clinics. Those are the bulk of what we do.
This is incredible work you're doing, and I mean, it's wonderful to be exposed to this as well now. Wonderful.
Yes.
How long has Penda been around?
Since 2012. Penda has been around since 2012. We started in Kitengela in 2012, and we have eventually now grown from one facility to about 18 facilities.
Oh, wow.
Yes.
I'm trying to do the math here. 24,000, you said a month?
Yes.
And then since 2012? Nope.
Exactly. Yeah. That's a lot of math.
That's a lot of math.
8 times 24. Now, Doctor, we obviously brought you in here, and I'm glad we sometimes good comes out of everything. We get to learn a little bit as well.
Yes.
But also just to talk a little bit about COVID-19 coronavirus. Now, you saw that you needed to basically be proactive when this happened, as opposed to being reactive. If we take an example like Italy, very reactive in their response to coronavirus, even the UK at this point, and you're actually seeing now the results of the wait and see attitude. What made you think that, hold on, this is going to be bad, we need to get into these areas?
Yes, as Penda we were proactive, not reactive. Because from January, when we looked at the global picture and we realized that this disease is spreading, and because of the previous knowledge that how respiratory viruses spread, we could see that this is going to be a global pandemic sooner than later. So what Penda did was formed a COVID-19 task force all the way in February.
Wow.
Early February.
Wow, that's really great. Yeah.
Yes. And then the immediate task was to get the utilities, the consumables, the drugs, and then the personal protective equipment.
Right.
We bought a lot, such our warehouse is full.
That's
in readiness
wonderful.
for this. So we have all the drugs for fever, and we have all the drugs for upper respiratory tract infections, like pneumonia and then any other URTI.
Right.
Then we also started training our staff on what is coronavirus. Even before it was named COVID, what is coronavirus, how it is coming, how it is passed on from one person to another. And then after that, when it was declared now here in Kenya, is that we ensured that we have enough workforce, so that in case a staff is unwell or we are overwhelmed with the patients, we are not going to have shortage of staff.
Now, when you say shortage of staff, this cannot be obviously clinical doctors. You can't just get 3,000 clinical doctors together to handle the problem. You're talking about boots on the ground, people that can physically support you as a doctor.
Yes, but we also have this the clinical people.
Okay.
Yes, we have the clinical people because we have been having a pool of people who work. So now we have a bigger pool, which has been recruited by our HR department.
Incredible.
Wow. I was going to say, I really appreciate the steps that you guys are taking, and if you're hiring, Farid and I are here. I love that you are, educating and spreading the word in the lower income areas, but I feel like at this point it's our government officials that need to need to listen up. Don't you think, Fareed?
Yeah, I think that, we what we've discovered is that this disease does not discriminate.
Yeah.
It doesn't.
Yeah, and actually, if you look at the global picture, it's the well-traveled, it's those who are talking to the high and mighty. I mean, if I said yesterday on air, if Prince Charles can get it, this is a whole different level of elite.
Yeah.
This is not even money elite.
Yeah.
This is someone who lives in a protective bubble and has done for his entire life, and now he has coronavirus, so it doesn't discriminate. I have a question for you. When you talk about protective gear, and are you talking about what Nadia's got on her face here, the face mask, or are you talking about protective gear for you as medical practitioners?
What we are talking about protective gear is scaled. Protective gear is highly dependent on who is actually using and the level of risk of this person. Right now, at Penda, before any patient or whoever enters the facility, there is a person there who is standing by the door to screen you for the common symptoms of COVID. That person has a face mask. What Nadia is putting on. Right. That's a face mask. Then, if there is high suspicion that this patient has coronavirus symptoms, compatible symptoms, then the medical person who is going to attend to this person now has extra, not only the mask, but also has gloves and also has an apron.
Right.
Then, if you get into an inpatient setup, maybe like Bagathi, where now they are isolated, they have full even face protection.
So almost like a hazmat suit.
It's a full protection, as you see in Italy now happening, because then now the environment is highly contingent.
And I guess as a doctor, you can't practice social distancing when you're treating a patient.
No.
Yes, that's why you have to be fully protected, because you have to listen to the chest of this patient.
Right.
You have to examine the mouth of this patient.
Right.
You have maybe to put a branular or maybe intubate the patient. So social distancing is not going to be there. It is full protection.
It's also crazy that the developing countries are the ones struggling the most with resources right now, because I saw pictures of a hospital in the States where they're wearing trash bags because they've run out of protective gear, which is insane.
But that comes again from being reactive as opposed to what Penda did, which was proactive. Before the world ran out of protective gear, you were like, hold on, this is going to be bad. Let's stock up at our warehouse, which is a fantastic initiative. When we come back, I think there's a question burning on everyone's lips, and I think mine as well as Nadia's here, is what have you seen so far in these high dense areas, and are the numbers correct? We're talking 31, I think? 30 something right now?
Yes.
Are they correct, or can we be prepared the more we test? Because this is exactly what happened in the United States. If you remember, a few weeks ago, in 24 hours, their numbers jumped 40% because they got the test kits in and started testing everyone. Are we going to? We'll talk about that in a minute. But are we going to have a similar problem here in Kenya? When we come back, Dr. Gabriel Njue from Penda. If you have any questions, get them in. You can tweet us at 984 in the morning #Favory and Fareed, or just give us a call if you like on 22 Mix of Music. We have Dr. Gabriel Njue from Penda. Penda is an organization that works in the lower income areas. Providing world-class health care to those in need of health care that can't afford our private and sort of upmarket high-end hospitals. There we go. And we've been discussing this morning about some of the work you do and some of the work you've been doing since 2012. Great initiative. Really glad that I'm learning. I get to learn new things every day, especially during this COVID-19 thing that's happening, this pandemic, and to learn about your organization. So first of all, hats off to you and the work you're doing. I think it takes a very selfless human being. I'm sure you could have a very high-paying job in one of the private hospitals and probably go in at 9 and leave at 5 every day. And I'm sure you can, right?
Yes.
But instead, you've decided to dedicate your life to helping those in the most need of medical and health care. And for me, that's a wonderful initiative. We've agreed, Nadia and I, sometime next week, we're going to come and see you at one of your facilities and document that and just see some of the work you're doing, because I'm very curious.
Me too.
And also very impressed.
Most welcome.
Now, we talked about this off-air. We've talked about it quite a bit on-air over the last week or so. I think the biggest fear right now is if a case, let's just take one case for example, hits an area that is dense with population, i.e. an informal settlement, or the areas you're talking about where you operate from, Embakasi, Kitengela, etc. What happens then, doctor? Because this is now a highly contagious disease in an area where people are kind of...
So this is a high risk issue, whereby we all do know the virus does not move. We human beings are the ones who are moving the virus from one person, point A to point B, from Wuhan all the way to our Embakasi area. And now when we say that the virus, one person has a potential to spread to 2 or to 3 people, is maybe in standard environment areas. But in high density areas, like where Penda operates, we say Embakasi, we say Kayole, we're saying Kahawa West, the chances of one person spreading the disease to more than 3, 4, 5 people are very high. So what would happen is that one person getting in these areas, then the spread, the pandemic, the epidemic would grow at an exponential rate.
Right. Now, how many people from your medical background do you come in contact with? Does the average person come in contact with in a day? I mean, what would be the sort of norm? There must be like a mean average.
So, like, if you work in a private hospital, for example, which has very few patients, the chances are that you are maybe interacting with 30 or so people in that facility. But when you consider, for example, where Penda operates, where we are seeing 100 patients in a day, and in one facility, one patient is being brought by another one person or 2. So you can see, if you have a staff of 20 in that facility, you have interacted with the 20 members of staff and maybe 2 security people. Then you have 100 patients who have come in, and maybe out of the 100, 50 of them were accompanied. So you're speaking one member of staff working in Penda or in such an environment, interacting with 200 people
per day.
In a day.
I think we even gingerly calculated Farid's from the time he woke up until here. 30, what was it, like 20 something, right?
About 10 now.
About 10. Okay, yeah. There we go. But it's also that, like, if you interact with one person, you're also interacting with everyone that they've interacted with, technically. So that's just exponential.
It's ridiculous. Actually, it's crazy when you think about how many people. And it's so funny now. How did we take that for granted? You know, you never you never stop to think about how you spoke to so many people in a day. You just go about your day, and now you're like, I would die to talk to that many people in a day. You know what I mean? Doctor, in the work you're doing right now in these high density areas, have you? Is there a concern? Have you found any cases? I guess of the 31 that we have any been found in the hospitals that you work from?
None of them is from Penda.
Okay.
But we have been having suspicious cases whereby we've really isolate them, we treat them, and we find maybe it's just a normal URTI that we are dealing with. Right. But we still take the precaution, one, to educate this patient.
Okay, just in case.
Just in case. It could be because, you know, COVID, for you to be diagnosed, you ought to be taken to Baghdadi or Kenyatta or elsewhere, you must be having the symptoms. So, and there is about 81% of the people who have this have mild or no symptoms.
This is good. I mean, I think the biggest fear for everyone and is that if this does hit one of these areas,
yes,
it's going to spread like wildfire.
If it hits one of these densely populated areas, it's going to spread like wildfire. As I have said, when you see one healthcare worker interacting with about 150, out of this 150, if they just interact with other 3, that's 450 almost direct contacts from one person.
This brings 3 degrees of separation to a whole new meaning, actually, because now you're. Yeah. I think the one thing we're going to take a break now for the headlines, but the one thing that I've learned through this is that the world is so closely connected.
Yes.
This big global village we live in.
Yes.
From one guy somewhere in China, in a town that no one had really ever heard of before, you know, in a province that no one had really heard of before. Yeah, and all of a sudden, the entire world is on basically a lockdown, or at least it's looking that way as well. Yes. The world has stopped.
Yeah.
In essence, the world has stopped. Yeah. When we come back, we'll talk a little bit more about some of the work you do, but also I want to get more into this densely populated areas and find out a little bit more about the contagiousness of this, because I don't think we're taking it seriously enough as a population. It's 26 minutes to 8. Time
into our facility is educated, whether you have symptoms or you do not have symptoms. We educate you. What is COVID? Where did it come from? How is it spread from one person to another? And we take time to answer all your questions. Most importantly, how you and your family and your close contacts are supposed to be hygienic. So that is as far as hygiene is concerned. Then when it comes to now the management of the social distancing itself, in the upmarket, social distancing is very likely to be implemented.
We have space.
We have space.
Right? I mean, that's the long and the short of it. You have space.
We have space. Even in our living room, we have space. But when we get to, for example, the areas where Penda operates in, we want to give these people world-class health care because they are human beings. They deserve quality health care.
It's wonderful.
Very wonderful days. But the challenges which are there is, for example, the living space.
When they go home.
When they go home, the living space is small. Even in the marketplaces, it's also congested. The water spaces are also, the water points are also shared. But having those challenges does not mean that we succumb to these challenges. We must rise as a nation and as a community above these challenges.
Right.
So number one is that the community needs to be educated. That like now it is raining, you need to harvest the water. Those common water points need to be protected, and then they can, even some of them are going ahead, that they can changa a few coins and have soap and water there, so that each and every person who is coming here into this small supermarket or into this water point, they still clean their hands with soap and water.
Yeah, I actually saw that driving. Sorry, I saw that driving to Naivasha on Saturday when we stopped to get. I won't say what we stopped to get cigarettes, but but the kiosk actually had a hand washing station as well. So there is
that's amazing.
There is some movement in that area. I think people are starting to listen a little bit. But I think social distancing will always be the issue.
The issue. We're just so conditioned as Kenyans. People love to hold hands and hold each other in general. But I do have to applaud Penda because, like, I think at a time where things are so intense and overwhelming, it's easy to see a patient and then be like, okay, you don't have the symptoms, go away. But I feel like that extra step to educate people.
Yes.
You know, if they say prevention is better than cure, at this point we don't have a cure. So prevention is all that we have.
Is the only thing that we have at this point in time.
And it's going to be a long time. We were told by a doctor last week from the Aga Khan University, an American doctor who's working in microbiology at the Aga Khan, that even if they find the vaccine... No, it wasn't. It was the guy...
virologist.
The virologist from Nairobi.
Moses.
Yeah. Even if they have a vaccine, you got a year to 16 months before they can roll that out anyway, because you could test it on 3 people today, but now you have to create the same formula for 10 million people, and that is where the challenges come in.
Yeah, exactly. And also affordability of that vaccine.
Of course.
Before it is rolled out, it is going to be expensive. By the time it is produced for the billions of people in this world, and it comes to us here, it's going to take longer.
Let's talk about one more thing before we go. Italy has the number 2 healthcare system in the world.
Yes.
I think Spain is France is number 1, then Italy. And they are completely overwhelmed.
Yes.
They're taking the elderly off respirators to give them to the young folks because they're saying there's no point really, right?
Yes.
Now let's move now. That's out of 190 World Health Organization members. Italy is number 2.
Yes.
We are number 142 in Kenya out of 190, which is not great by any stretch of the imagination, right? No, I mean, but we're not the worst, but we're not in the top tier. If we have an Italy-type problem here, what happens to our healthcare system?
This is why I say that the problem is grave, and Kenyans need to take this seriously. Is that in our healthcare setup, we have been having people in the past, before COVID, where you find all ICUs that we have, affordable ICUs, are full.
Yeah, we don't have enough beds, that's for sure.
We don't have enough beds, and the hospitals are also full, and that was pre-COVID era. So you can now imagine if the Italy type of scenario was to be in this country, it is that we would be extremely unable to handle this. That is why the government, and we really thank the government, the president, and even the CS, Mutahi Kagwe, for coming out strongly to ensure that the public health hygiene and infection control measures are implemented as early as possible. Because a healthcare system that we have right now cannot be able to sustain.
It will collapse.
It is going to collapse.
It will collapse. I think you put it best when you said prevention is better. In Kenya and Africa's condition, prevention has to be better than anything else.
Has to be better than anything else.
With that,
even if it's going to be forced by the government.
Which means a total lockdown.
That's what I was going to ask. I was like, do you think that they made a mistake putting in the curfew as opposed to an absolute lockdown?
I think that the president is right, because we have to take scaled measures, and also hoping that Kenyans are going to take it with a seriousness.
And be responsible for yourself.
They have to be responsible for themselves. But in the event, as he said, that you are not going to be responsible for yourself, he is going to pull up the last measure, which is total lockdown, so that you don't move.
Yes.
Which is going to be deleterious for
it will just be us, broadcasters. I think the list was there yesterday. Broadcasters, nurses, doctors, essential services, and that's it. And I already don't like the way Nairobi feels right now in terms of coming to work. It's like a ghost town. I don't want it to get worse. You know what I mean? But I do understand that if we as Kenyans cannot control our behavior in terms of protecting ourselves and those around us, then I think it's inevitable. I think it's necessary that you say, right, you know what, we gave you an option of 7 p.m. to 5 a.m. That didn't work. Because you know what, when I was being told yesterday, it's going to be like Alcoblo on the roads from 7 p.m., but it's going to be people checking to see if you're it's like a curfew type thing, but now you'll be stopped at checkpoints if you're driving out. And, you know, I carry my ID with my media ID with me because they're going to ask for those things. If you're out and about at that time. I don't know if you have any more questions, Doctor. I just want to applaud you and congratulate you. And really, truly, we've been having a lot of tearful moments, and I'm getting another one now. When we hear some of the wonderful stories, we talk about wonderful stories from around the world, and we were very light on wonderful stories from Kenya. But I think yours is a wonderful, wonderful story, and I really appreciate the work you're doing.
And I think if we could, we would pat you on the back, but it's physically impossible right now.
Thank you. So I would end up by saying, one, it's to thank the government for the steps that they have taken to control this infection control measures they are taking, and also at this point in time also thank the Penda team for the preparedness that we started early in January. And I would like every other healthcare system to be extremely prepared and teach the population. Every patient who comes to every healthcare organization, like we are doing in Penda, educate each and every of these patients.
Absolutely.
So that they are well aware protecting themselves is number one.
Yes.
And the only way to conquer coronavirus is that you need to protect yourself. Absolutely. Prevention, as we said, is better than cure. Final comment, if any of our listeners want to find out where you operate from, is there a website that they can find your locations? Yes. We have Penda Health. .org, and we are found in about 15 or so locations. We are in Pipeline, we are in Embakasi, we are in Tasia, we are in Kayole, we are in Umoja 1, Umoja 2, we are in Githurai 45, we are in Simaman, we are also in Kahawa West, we have also been in Langata and Ongata Rongai, but those are temporary, we are not yet operational there. Okay. So we are wide in Nairobi. Right, and you mentioned a call center number if you are feeling like you need some advice on coronavirus or COVID-19. Oh yes, Penda has put up a toll-free call center whereby you can call and tell us your symptoms, and then we can triage you. It is managed by medical people. They will listen to you just like we can listen to a patient when he's next to you, and we are going to give you very good advice on whether you should go to a hospital or not, because we care that you should not come to a healthcare facility with minor ailment where you don't get exposed to a disease. And we also care that you don't come with a disease, corona disease, then you expose other patients. Right. Yes. So we care both ways. So you can call us, and we shall give you this free advice. Okay, we'll list the web URL and the toll-free number on our Twitter handle this morning. Dr. Gabriel Njue from Penda, thank you so much. We will come and visit you next week. Most welcome, most welcome. Take some photos, just some of the great work you're doing, so we can also help promote your initiative. And again, another wonderful story coming out of Kenya. It's your story and your team's story. Thank you so much, Doctor. Thank you so much.